According to the World Health Organization, cardiac arrest is the leading cause of sudden death globally, with thousands of deaths occurring every year. In the United States alone, an estimated 350,000 to 450,000 deaths occur every year as a result of cardiac arrest. So, does this number sound an alarm to you? And do you think that something needs to be done urgently to reduce this mortality rate? That is why you need this video at this moment. Welcome to Jossy Health Tips. My name is Efogo Joseph. I am a registered nurse and an occupational health and safety professional. So I'll be teaching you in this video how to do your CPR the right way to enable you to save lives of people who you might come in contact with that are suffering from cardiac arrest, or even to be able to assist member of your family who might need help at any given time. So I will beg you to take your time to follow this video to the end. Take your time to listen and make sure that you get the critical points from everything I'm going to be sharing with you in this video. I'm going to adopt two modes of teaching. I'm going to share a PowerPoint presentation where everything is explained in detail, and then continue with the video so that everything you're going to be seeing in the video will not look strange to you. Okay, relax and watch the video.
Welcome to Jossy Health Tips. In this video, you will learn the basic steps of cardiopulmonary resuscitation, also known as CPR. CPR is a life-saving skill that anyone can perform to help a person whose breathing or heartbeat has stopped. Acting quickly can save a life. So having understood that, what is CPR? CPR is an abbreviation for cardiopulmonary resuscitation. It is an emergency process applied in case the heart stops its beat or when a person stops breathing. CPR assists in pumping blood to the brain and important body organs with oxygen until medical care is obtained. So, what this simply means is that the person who needs help has suddenly collapsed. He is no longer receiving oxygen, nutrients and blood supply to the various parts of the body, especially the brain and other vital organs, because the heart has stopped beating and the respiration has also stopped. So in this case, that person will need a help. So that is what CPR is all about. You now giving that assisted support to make the person survive. So when does the person require CPR? CPR is required when an individual cannot respond, his breath is no longer regular, or he or she only gasps for air, assuming that the individual does not respond on being tapped and addressed, he or she might need CPR. So, in other words, this person's this person has stopped breathing, the person's heartbeat is no longer normal or has stopped. Or even when you notice something like gasping or what we would call agonal respiration, it simply means that the person is actually not breathing. He's just trying to survive. He's just trying to get air. He's opening his mouth, but air does not come in. So you have to give that assisted support. So if you are able to recognize that agonal respiration or gasping, it simply tells you that the respiration you are seeing is not normal. You should provide what the person needs to survive. So for you to start CPR, you need to ensure um, scene safety. You have to ensure scene safety. So how do you ensure that? You look around to be sure that everything is normal. Number one, that you, who is the healthcare provider, the responder, is not in danger because you need to be alive to be a hero. So, what has happened to the patient is what should give you a clue. Number one, has there been a fire outbreak? Has this patient been a victim of electrocution? Has there been any sharp objects that fell on him, or did he fall from a height? Or are there any other things that could happen? Has he inhaled poisonous or noxious gases that have made it impossible for him to survive, or that has shut down his system? These are things you need to find out. So that is why, in this case, you first of all look around to be sure that the environment is safe enough for you to be able to intervene in this patient's situation. All right. Having checked that the environment is safe, you can now proceed to the patient. You check responsiveness. How do you check responsiveness? You simply tap gently on the shoulders and ask loudly, "Are you okay?" If you tap and you say, "Are you okay?" and you watch for any movement, sound, or response. If there is no response, you have to proceed immediately to the next step. So I'm taking time to explain these things so that when the video comes, you will know why every stage is done the way it is done. You will not be confused as to why these are done. I'm just trying to give you the rationale for everything you're going to be seeing in our video. So I beg that you exercise some patience while you watch this video. So if you have ever had a brother or sister who was a victim of cardiac arrest and you didn't do anything, this video is very important for you so that you will be able to learn basic skill that will help you to assist when next you are faced with similar situation. It could be immediate member of your family or a friend or anyone else. All right. Now that you have gotten clarification, you have checked that this patient is not responding, you have to call for help immediately and you shout for help right away. In the case you are alone, make an emergency call to your local emergency number. And that depends on what your medical career is in your own country or state. So if it is 911, it is 912, whatever it is, 120, whatever number that applies to your country, you call that number. If there are people nearby, request someone to call an ambulance and get an automated external defibrillator or AED, assuming that there is one available nearby. So you just ask the person to get an AED. Okay, so once you have done that, check breathing and pause. Open the airway by gently tilting the head back. Bend your ear close to the patient's mouth and nose. Why do you do that? If the person is breathing, you should feel some air touching your face or very close to the side of your ear. Look for chest movement. If the person is also breathing normally, it should reflect on the chest. Listen to or listen for breathing sound. You could also feel that if your ear is close to a mouth or nose. And feel for air on your cheek. Yeah. Check the carotid pulse. That is located on the side of the neck. Just the small furrow on the side of the neck. You touch it, you can feel the pulse there. You check it with your two fingers. Do everything that you need to do in this assessment within 10 seconds because time is of the essence. You don't need to waste a lot of time while checking for response or all these things. Then you start compression. Once you have confirmed that there is no response, there is no breathing, there is no pulse, you just start compression immediately. In the case individual is not breathing normally and has no pulse, start chest compression. Put the heel of one hand in the center of the chest. Then place your other hand on top and cross your fingers. Push sharply and quickly at a rate of 100 to 120 compressions per minute, minimum of 2 inches deep chest compression. So you have to press the chest to a depth of at least 2 inches. Also ensuring that your elbows are straight as you have crossed your hand and placed your heel on the chest and the other hand is on knit and cross. Straighten your elbows, otherwise you will be delivering your CPR very poorly. Then give rescue breaths. At the end of 30 chest compressions, give 2 rescue breaths. Now we said that your target is to give 100 to 120 compressions per minute. So you are not going to give that straight away. What you're going to be doing is that you are going to target 30 chest compressions and deliver 2 breaths and continue till you get to that 100 to 120 within 1 minute. So, in other words, within the first 20 to 30 seconds, you would have been able to deliver the first 30 compressions and 2 breaths and continue again until you get to 100 and above within 100 and 120 in 1 minute. All right, pinch the nose. How you do is to pinch the nose of the patient, cover his mouth with yours, and give one breath, lasting 1 second. So watch for the chest to rise before giving the second breath. So if the chest does not rise, it means you might be delivering your breath into the patient's stomach, and that could inflate the stomach and make the patient to throw up. If the patient throws up, that could also worsen the situation, meaning that the patient could even inhale the vomiters, and because it's unconscious, that could worsen the entire situation and worsen the unconscious situation you are trying to manage. So tilting the head backwards is very important. So continue your CPR. After you have given the first breath, you should continue again for the next 30 compressions and then another 2 breaths. Do not stop CPR unless the person starts breathing normally. So if the person does not start breathing normally, you should keep doing your compressions. The other reason why you have to stop is that emergency responders have arrived with the ambulance or whatever means they have come, and you now see that the adequate hands of professionals, you can stop doing your CPR at that time. Or an AED has come and ready for use. But the AED does not say you should stop compression entirely. It means that you should take that small break to attach the pads to the chest of the patient and continue your CPR while the system analyze the pulse and whatever. So, or when you become physically exhausted that you can no longer continue the CPR, you have to stop at that stage. All right, the next thing we'll be looking at is important points to remember. So when you are doing your CPR, these things must be at the tip of your fingers. One is that you should push hard and fast because you are targeting to give 100 to 120 compressions in 1 minute. Then allow the chest to fully recoil after each compression. What that means is that you push down the chest. You should also allow that same chest to go back up to where it was before you push it back again. So there must always be compression and recoil of the heart, of the chest for adequate blood to fill the heart and pump out as well. And then minimize interruptions. So every distraction must be stopped. No unnecessary. If the patient's clothes okay, you are checking everything. Those ones will eat up your time and limit the time the patient will get the maximum support. If you are not trained to give rescue birth, perform hands-only CPR by pushing hard and fast in the center of the chest. So what this is saying is that if you do not know what to give as far as the breath is concerned, like I said, you could actually inflate the stomach. So if you don't know what to do at that point, don't try to give breath. All you do is to just do the pushing alone, which is the normal fixing the hands and pushing for 100 to 120 compression per minute. The enhanced only CPR, the untrained bystander should use, this is already what I've explained. The untrained bystander should use hands only CPR. Put your hands in the mid chest area and carry out constant chest compressions until help comes. This simple action can save a life. This simple action can save a life. So even if you do not have the 100% knowledge of what to do, this one that you can do and you are doing it enough, it can help to save a life. At this point, I want to ask, have you ever done CPR before and you actually helped maybe as a non-professional? And what was your result? What did you get? Did you feel bad if you did not get positive result, or did you feel okay that at least you tried your best? So you can give this comment in your comment section. Let's see, and at least this will help us to know if people are actually getting these things right or not, and how we best could help them to get more knowledge. Now, CPR for children and infants. For children, use one hand. Remember, for the adult, we say you're going to be using two hands. But in case of a child, you should use one hand for the compressions. But for infants, those small babies, don't use one hand also. You use just two fingers. The same way you put in the middle of the chest for an adult, the same place you're going to put two fingers there and use it to compress to about one-third of the baby's depth, of the depth of what you did for an adult. So be gentle but effective. When we say be gentle, it means that you shouldn't use all your power to press down the heart of a child and injure the child. Remember that the vital organs of this child are still fragile. They are not mature enough. You could actually injure them when you do too much pressing on them. So that's why you need to be careful what you're doing for the baby. Then, in conclusion, CPRO saves lives. Early action can double or even triple a person's chance of survival. Learning CPR empowers you to make a difference in emergencies. Thank you for watching Jossy Health Tips. Please like, share, and subscribe for more health-saving information. Thank you.
Ensure the scene is safe. Check for responsiveness by tapping the patient on one shoulder. Check for normal breathing and a carotid pulse on the side of the neck for no more than 10 seconds. The patient is unresponsive. Activate emergency response and get an AED. Begin chest compressions. Place the heel of one hand on the center of the chest on the lower half of the sternum. Open the airway using the head tilt chin lift technique. Give 2 rescue breaths. Each breath should last 1 second and make the chest rise. Put your hands on the center of the chest. Push hard and fast at a rate of 100 to 120 compressions per minute.
Get ready to use the AED. Apply pads to the patient's bare chest.
Analyzing heart rhythm. Do not touch the patient. Shock advised. Clear the patient.
Shock delivered. Begin CPR. Prepare to give 2 rescue breaths. Give 2 rescue breaths. Resume chest compressions. Analyzing heart rhythm. Do not touch the patient.
Shock advised. Clear the patient.
Shock delivered. Begin CPR. Continue CPR until advanced help takes over. This video is for educational purposes only and does not replace formal CPR or emergency number immediately.